Much appreciate your testimony. Appreciate all the witnesses' testimony. I will now begin the question and answer portion of our hearing, and I will recognize myself for 5 minutes. Dr. Benjamin, I would agree that making this issue into a political football will not help us. It will distract us from our job. It's true early on, President Trump made statements that turned out to be in error. It's also true that then candidate Biden made statements that turned out to be in error. What we need to do is to get answers from the CDC so we can figure out what went wrong, what went right, and what we can do to move forward appropriately. Dr. Dunnigan McCauley, I heard in your opening statement that just like this committee, you're having a hard time getting answers out of the CDC. Is that correct, yes or no?
Yes.
And do you feel that the lack of being able to get these answers has impaired your ability to give us an assessment of whether or not this reorganization is going to help solve problems or not?
We do need more information.
All right, and I appreciate that, and I agree with you. All of us need more information if we're going to try to make this not a political football, but something where we're just trying to get to the facts, as Jack Webb would have said many years ago, just the facts. All right, Dr. Hogue, I got to tell you, I appreciate your testimony, very concerned, and as I said in my opening statement, I don't think my kids have yet recovered. The schools in my district were scared that if they didn't follow the CDC guidelines, they would be sued. I talked to a number of them, and that's what I was told behind the scenes. Well, we don't know that we think we can do it, but if we do it, our lawyers tell us we're in jeopardy. And so they closed them, and then they kept them closed for longer out of fear of reopening because the CDC guidelines about reopening came out, and they did not reflect, as you said, science. They clearly ignored your studies. They clearly wouldn't publish your peer-reviewed paper in their flagship journal, the Morbidity and Mortality Weekly Report. To your knowledge, to any extent, did they consider the science, the studies, the reports that were out there showing that among school-age children, social distancing and transmission rates were fairly low, if existent at all?
So we had data very early on from Europe, from already June of 2020, that comparing Finland to Sweden, that reopening or having schools closed did not have any impact on community transmission of the disease. And we had similar investigation from the Centers of Global Education and Development that they found similarly with all of the countries that reopened their schools, which was most of Europe in the spring of 2020, that there was no correlation between opening and an increase in community disease spread. And so I think that we really, the CDC really failed for quite a long time to look at the data coming out of Europe, which, not only considered the very low transmission that we were seeing in schools, but also considered the effects, the long-term effects and the collateral damage of keeping the schools closed. And many private schools were open. I was the advisor for a large diocese in Sacramento where we reopened the schools actually based on the data out of Europe in fall of 2020. And we were able to keep them open the entire year and had a very successful year. And it's very sad that schools, especially public schools, especially inner city schools, defaulted to the CDC for their guidance when the CDC was really, they were, well, we know that they were basing, at least in February of 2021, their guidelines on the teachers' unions, what the teachers' unions wanted, rather than the science that had been accumulating for months out of Europe and our own country, also from our own daycares. And so it's really tragic what happened to American children, and I do view it as a result of politicization and schools relying on the CDC and defaulting to them, and it hurt our nation's children.
And it wasn't just the inner cities, it was also the rural schools and everywhere that you have any disadvantaged children, because what I've done for my kids is we've brought in tutors, and they're catching up. I don't think they'll ever get fully recovered for that lost year, but they're catching up. But most families can't afford to bring in tutors 1 or 2 times a week to try to get that, particularly in our family, math, to get that math skill back to where it ought to be if they'd been in the classroom. Would you agree with that, yes or no? Because I'm running out of time.
Yes, I agree with that. Yes.
All right, and because I'm running out of time, I'm just going to make this next one simple. It's not just the learning. it's also the mental health, is it not? The socialization, the lack of socialization, and for kids that are already in trauma, not having that security of going to see their friends at school, not being able to have interaction with their teachers who love them, teachers are great, is a mental health crisis in and of itself, is it not? Yes or no?
Absolutely.
I have to yield back.